I have not brushed my teeth since I was 8 years old. I just do hydrogen peroxide.
Oral disease, like any other disease, depends on a lot of factors. We really need to make sure we don't do this. So,
The best time to use mouthwash is not after brushing like most do.
acidity can cause erosion, which means your enamel is a little bit softer than usual and you're going to wash out some good structure there.
Women's saliva pH is not 7. It's frequently 6. It's frequently 5.5.
Ideally, we want a pH close to 7. Anything below 6 and 5.5 is... I'm Dr. Maria Florou, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. Hey guys, today we're going to be watching together some videos that have been viral on the internet. And I have to say to you that this is the first time I'm watching them. I'm watching them with you. And I'm going to share with you what I know, but please do your own research. Make educated decisions about your health. Talk to your dentist, to other health professionals. But let's look at this together.
Why would I go to a dentist in America? One of the biggest scams I've ever seen. A dentist who's telling me to brush with toothpaste that has fluoride. They're trying to get me to rinse my mouth with fluoride. Are you serious? Are you serious? I will never.
Oh, wow. Yeah, that is a big, big one. I hear that all the time. But what I'm going to encourage you to do is do your own research. I know the great majority of oral products that we see out there have fluoride. Are there better things than fluoride? Nowadays, definitely. We see a lot of other things that we could use to replace fluoride. But yeah, do your research, watch our previous videos. There is a place for fluoride in dentistry, but how much that affects your health, I'll leave the research for you to do.
They don't know that fluoride's a neurotoxin that's been directly linked to dementia and Alzheimer's. So if you're a parent watching this, man, fine.
Yes, look, he has a point here, all right? We leave dental school learning well how to look after teeth, and that is great. I'm very proud to have taken this journey, and I'm very proud of my colleagues for doing that. We just need to learn to look outside the box. We just need to look beyond. And I understand then that in 5 years of uni, we won't learn about the whole body. We're not doing medicine, but we should learn and educate ourselves in integrative approaches and look at the people beyond just their smile and beyond just what's happening in the oral cavity, but connecting everything. So yeah, that is a big one. It's confronting. I like how she's very open to showing everything there. Very authentic.
With less inflammation, no cavities, and just an overall healthier mouth. So let me give you some tips that will help you achieve that. Tip when using an electric toothbrush is to evenly distribute the toothpaste.
Just a quick note about this one. Everything she says here is great. I really agree with her. It's great when we see the before and afters of our patients, how much they really implemented in their daily routine and the changes that has brought to them. That's amazing. When it comes to the quantity of toothpaste, not so much. It's a pea-size amount. It's just a little pea size. You don't have to go all across your toothbrush there. It's just a pea-size amount will do the job. Let's see what else.
It removes plaque buildup, whitens my teeth, and kills the bad breath. Flossing is going to help remove plaque and debris in between.
I don't mean to criticize. It's just that I recommend flossing first. So we start with the flossing and then we brush. We've mentioned this on another episode. Go there, check that, but it's flossing first, okay?
Between the teeth. A little tip is to get your floss and add a little bit of fluoridated toothpaste, especially if you're cavity prone in between the teeth.
Okay. Yes, I agree with her on that. I wouldn't use this particular toothpaste. We can use something with nanohydroxyapatite. Rub that on the floss or put a little bit with your fingertip, a little bit around the area where your dentist has said to you, look, we have a start of a cavity here. We can still heal that. There are ways of healing small cavities. One of them, it's doing what she's just done here. So just spreading a little bit of good quality oral health product and putting with the floss to heal the area that we need healing. So
if you use this method, you want to floss after you brush your teeth.
yes, if you want to leave that, do it after brushing your teeth. What I tell my patients to do is floss, brush those areas where we want to heal those initial cavities, those little cavities there. We are going to floss again after brushing. So we've removed all the plaque, food that was sitting there, everything is nice and clean. Then we're going to apply the medicine for the healing to happen. Real quick, your mouth is the gateway to your overall health. And at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode.
The best time to brush your teeth is in the morning before you eat or drink anything and right before you go to bed. The best time to floss is not after you brush like some people do it, but rather right before you brush your teeth. The best time to use mouthwash, if you do so, is not
in the morning, you woke up, you might have had a little bit of reflux at night. I'm not sure about your situation in particular, but rinse your mouth first. If we have any acidity sitting on your teeth, I don't want you to go straight brushing them. As we mentioned in another episode, acidity can cause erosion, which means your enamel is a little bit softer than usual and you're going to wash out some good structure there. We don't want that. So rinse first, ideally with some alkaline water, and we bring that pH up and then you start your routine. Let's see what he's going to say.
mouthwash, if you do so, is not after brushing like most do, but actually before you brush your teeth because you want the toothpaste to stay on your teeth after you brush. The best time to use oil pulling, if you do so, is before you brush, before you use mouthwash, but after flossing. The best time to tongue scrape, if you do, and you should be doing it, is before you brush, before mouthwash, before oil pulling, before floss. It should be the first thing that you're doing, especially in the morning. And if you use a water pick, you should be doing it before brushing, before mouthwash, before oil pulling, but right after you floss if you're doing so, or occasionally instead of the floss.
All right, so let's make your life easier here. Start by rinsing. Let's elevate that pH there. Second thing, tongue scrape. Then you floss or water floss. To be honest with you, I prefer the water flosser, and especially in the morning, but throughout the day, like I always prefer the water flosser. You can floss as well as water floss and then brush. I'm not someone who's going to advise you on mouthwashes unless I'm using the mouthwash as a treatment for a certain condition, for inflammation, and just for a short period of time. The oil pulling, I'm going to leave for another conversation because it's a big, big topic. I don't see any harm in doing it. I'm just going to leave that one with you, but we're going to talk about it on another episode.
I have not brushed my teeth since I was 8 years old.
Your teeth gonna fall out, man.
Oh yeah, I'm 62 years old and I got every one of them, never had a cavity, and have never had any problems with them. Go figure that one out.
8 years old.
No, I just do hydrogen peroxide. No, the reason why...
Okay. All right. I do get a patient that I see in the practice every now and again, not without brushing their teeth for blah, blah, blah years here, but that say, I haven't been to the dentist for the last 30 years. Yes, I do see patients that tell me that. And it's interesting. Look, as I said, oral disease, like any other disease, depends on a lot of factors. We really need to make sure we don't do this, though. And the hydrogen peroxide that he's mentioning here, it is good. It's good for a certain period of time. It kills bad bacteria, but it also takes away some good bacteria with it too. Let's see what else he's saying here.
Take that same toothbrush on a rusted chrome bumper and watch it just take all the rust right off the bumper. Now that's the same thing that you're cleaning your teeth with. What you're doing is you're withdrawing the enamel. In other words, you're taking the enamel, the protection off your teeth when you brush.
All right, cool.
Look, I'm a natural.
Look, guys, He has a point. If you're using something too abrasive, either the toothbrush or the toothpaste or charcoal, bicarb soda, all the things that I hear about, be aware of how abrasive those things are to your teeth. Look, I'm not saying follow this advice, but, he has a point.
So here's something you could tell all the men in your life. Women's teeth are very different from men's. This is why this is important. Hi, I'm Dr. Ellie, and I'm here to help you avoid unnecessary dental treatments. I hear all the time, and it amuses me.
Starting here, men's and women's teeth. Yeah, the shape is different. We can actually tell by looking at a skull if it was a man or a woman because of the shape of the teeth. Now, there is a big influence when it comes to gums health because of hormonal difference between men and women, but I'm curious to know what she's going to talk about.
I have cavities, I have gum disease, gum recession, all these problems.
True.
And there's my husband or my fiance or my boyfriend. He doesn't even clean his teeth half the time, and he doesn't have any of these problems. So why is this?
Look, I wouldn't put this down. I haven't watched this video, as I just mentioned. I wouldn't put this down to men and women. Yes, we do see hormones playing a big role when it comes to oral health. But, I grew up in a house with two sisters. My sisters had no cavities. I was the only one who had cavities. And I'm like, come on.
Well, let's go back. Let's take a step back. I was at dental school in the 60s. And it was fascinating because I was trained to believe that the pH of our saliva was 7. It took me years, and it took me to get a pH meter and actually test all the people that I could find in my environment to discover that women's saliva pH is not 7. It's frequently 6. It's frequently 5.5. What does this mean? This means that an acidic saliva in your mouth, the liquid in your mouth, can be the very reason that your teeth are weakening, that you are promoting plaque in your mouth, that you're getting gum disease.
One thing that we can talk about, and we've spoken about this on another episode, is that yes, the more acidic the pH of your saliva is, the more problems we're going to see. So the way of checking that is easy. Just go to your closest health food shop or even the chemist there. You can buy some strips that can help you measure the pH of your saliva. You can spit on it, compare the color with the little index that it comes with it, and then you can see where your pH is sitting. Yes, ideally we want a pH close to 7. Anything below 6 and 5.5 is going to cause harm to your gums, to your oral environment there. So that's true. I haven't done the research between men and women, but leave it in the comments if it's something that you would be interested in, and we can discuss this in another episode. Thank you for watching. This was fun to do, actually. I had a good laugh about it. I'm actually interested in some things to bring to you in more details here. Thank you for staying with me through this episode. I'll see you next time. Please place some comments down below if there's anything here that you found interesting and you want me to talk more about on our next videos. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.